Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. What did they call it? Housekeeping. This is the Facebook I'm doing right now, and please check out the YouTube channel. It's also called GYN Corner. The podcasts are also called GYN Corner. And we're on all of the possible platforms available for podcast. And also, if you enjoy the content that I've been presenting, please hit the like button, the subscribe button, and the follow buttons, and the notification button so that you can find out when these presentations are coming out. So thanks again for joining me at GYN Corner. And today I thought I would speak about abnormal bleeding after the COVID vaccines because I have had, yesterday I had 3 patients in one day come in with abnormal bleeding after the COVID vaccine. So I figured this is an apropos topic to discuss. And last week I had about 5 or 6 patients come in with abnormal bleeding and quite worried and concerned. So I thought I would speak on that. Now, as we all know, I guess I shouldn't assume, but as I assume most people know, the COVID vaccine is a novel vaccine, which means it's a new vaccine we've never had available in the world before because it's a messenger RNA, so it's an mRNA vaccine. It basically gets your body to produce the protein that will allow it to recognize the COVID or the coronavirus for COVID infection. So it gets your body to produce the infectious elements, and then it gets your body to fight those infectious elements. So it acts like a tiny autoimmune disorder. And since it's new, it's never been tested before, we don't have data to predict what groups of people will have certain types of potential problems, who's at the most risk for problems. We don't have data to tell us what's going to happen when menstruating women or non-menstruating women or older, younger, doesn't matter, health status, what's going to happen to them when they get the vaccine. So this is an emerging, an emerging side effect from the vaccine. So there isn't any data. Just scientifically, my presumption, what I've been telling the patients, I've been prefacing it with that information. No one knows the real story. This is just a presumption. It's an educated presumption, obviously, because I'm a gynecologist, physician. So my assumption is because it creates, it has a lot of computer-generated different types of proteins which are trying to get your body to produce proteins that look like the coronavirus. So my presumption is that because it creates a tiny autoimmune disorder, that there's also some features of that protein that are attacking the lining of the uterus. We call that lining the endometrium, and that's where the blood builds up every month for a menstrual cycle. So my medical assumption is that because it's making your body create proteins, and then it's making your body attack those proteins so that it's primed, your immune system is primed against the coronavirus, that there are certain proteins that are also similar in appearance in the lining of the uterus. So for a lot of women, their body's also attacking the proteins in the lining of the uterus, and that's why it's causing abnormal bleeding. So the interesting part is a lot of women who are on birth control pills. Now, if you're on a birth control pill, it's just science. You're taking a medication. It's making the uterus build up a certain amount of blood according to the hormonal strength of that pill. And then based on which level of the pill you're on at a specific time, you're going to shed that lining. So it doesn't matter what your environmental factors are. When you're on a birth control pill, it should not be affected by those factors. So good stress, bad stress, change in activities, change in diet, that should be immune. When your cycle should be immune to those factors when you're on a birth control pill, provided you're taking the pill correctly. You're taking it every day at the same 1 hour time frame, provided that there aren't any factors which are interfering with the intestinal absorption of the pill. They're not interfering with the liver metabolism of the pill. So provided everything is normal outside of good stress, bad stress, change in activities, change in diet, yada, yada, how you are on the pill is how you are on the pill. The interesting fact is that with this vaccine, a lot of women who are on the birth control pill are having abnormal bleeding. And when I say abnormal bleeding, they're reporting to me that their cycles, say they're on a pill and they usually get 2 to 3 day cycles. They're getting 7 to 9 day cycles, really super heavy. One of the ladies yesterday said she filled a pad and a tampon in 1 hour. And that's why she came in. She was scared because she's just floodgates were open. And they're often lasting 7 to 9 days. I've had a handful of patients who have told me that it's been 2 months since their vaccine and they've had 2 cycles that were abnormal. So a couple of patients told me they didn't have a problem with the first shot. They started seeing the problem after their second shot. So after the first shot, they had a cycle, that cycle was fine. After the second shot, they had a cycle, that cycle was crazy. And a few who told me they had a problem after the original shot, after the first shot. So obviously, in my mind, that's a reflection of their body mounting the response to the mRNA. So the mRNA is telling the body to produce proteins to attack what it has made the body conjure up. So for some people, they're not going to develop a lot of proteins, or their body's not going to recognize those proteins so quickly after the first shot. So that's why their symptoms are mild, but after the second shot, their symptoms are enhanced. So that makes a lot of sense. So what I've been telling women is that in other aspects, when it comes to just irregular bleeding, skipped cycles, cycles too heavy, too short, too light, whenever there's a dysfunction of the menstrual cycle, medically, we always give it 3 months. So we make sure that you're not pregnant. We make sure that there isn't an infection that's causing the bleeding. And then if those 2 scenarios are fine, then we give you 3 months to naturally resolve that problem. So what I've been telling patients, we've done pregnancy tests and we send the urine for cultures, chlamydia, gonorrhea, and cystitis or bladder infection. As long as those are fine, to give it 3 cycles to see how they do. 3 cycles after the second shot. And then if by the 4th cycle it's still abnormal, then to please return so that we can evaluate, just to make sure that we're not missing something, that maybe just coincidentally that person got the shot and they weren't, maybe they did or didn't have the abnormal bleeding from the vaccine, but then it persisted because they had an underlying medical condition that developed, or any kind of microscopic tissue changes. So I've been telling my patients that if they're still having the abnormal bleeding by the 4th cycle, we know they're not pregnant, we know they don't have an infection, then to please return. We'll do further evaluation with checking their hormones to see if there's an underlying medical condition, doing an ultrasound or a sonogram to see if there's anything physically that we can see with the naked eye, and then continuing after that. So I hope that's been helpful information if you've experienced abnormal bleeding after getting the COVID vaccine. And if you have any questions on this that I can answer, please put a question for me on the Facebook and the YouTube. I actually don't see questions on the podcast, so I don't actually know if you can post questions there or not, but check out the YouTube. The YouTube's really cool because everything is itemized, and I have playlists on the YouTube, so you can just check out the playlist, or you can just go to the content for a specific title, just put in the search bar for a title. So it's very, very helpful. And as you may be aware, I've been doing these presentations for 2 years now, since I think it was March or April of 2019. Maybe even been 2018. Am I going crazy? Let me see. Nope, since April 10th of 2019. So thank you for joining me at GYN Corner. Have a great rest of your day. Bye.